I would like to call to
Josh
order.
has to start, hold on.
It started.
That's okay.
We're good, okay. I'd like to call to order this special meeting of the Board of Education on Wednesday, August 28th at 5:40 PM. Apologies for the brief delay. Ellen, if you would call the roll.
Sure. Mr. Berger?
Here.
Ms. Conway?
Here.
Mr. Corey?
Here.
Mr. Cronin?
Here.
Mr. Predis? Here. Mr. Euclid?
Here.
Ms. Hona here. Mr. Kisco?
Can you hear us?
Can you hear us, John?
Oh, looks like he dropped off. He's no longer on.
Can someone shoot him a text and just let him know we've started?
Mr. Putnam?
Here.
Mayor Carbona, representative? No. Mr. Knight is excused unless he's on the line? No? Okay. Ms. Ferguson?
Here.
Ms. Klemazewski not here. Mr. Pagola?
Here.
Mr. Petrozelli?
Here.
Ms. Schulte?
Here.
Ms. Fien's not here. Mr. Wilson?
Here. Great.
All set.
So we just have one discussion item and one action item. So I'm going to kick off the discussion on the health insurance plan proposals. I know we talked about this at length at our last meeting. So I have in front of me the numbers, since those weren't really talked about at length, and I know people want to know before we actually cast any votes. And in light of the questioning from the city's attorney on this, I just want to make it clear. So we have accepted bids from four different insurance carriers. Several of them submitted one of them submitted several bids for fully insured, self-insured plans on different timetables, including 9 and then 12-month commitments or 21-month commitments. We have seen the numbers, all the members of the board, I believe. There's sort of an obvious winner that Brown & Brown, our broker of record, discussed with us, which was the Anthem fully insured plan that locks in rates for 21 months. So that would be for the balance of this fiscal year plus the next fiscal year. I would say for my part in this discussion, I'm content to accept that plan. It will realize a not insignificant savings in year one here, largely due to the fact that for once our employees' premiums will actually be used to pay for their health care in accordance with their collective bargaining agreement, rather than padding the city's general revenue. So we're going to restore a little bit of integrity here on behalf of our dedicated employees, but importantly, we're also going to save money by using that money to pay what it's supposed to pay for. And then, even though there is, from what I can tell, a price increase for the second year, those savings will be realized to cover that, meaning that under this proposed Anthem 21-month plan, we anticipate no significant budget hit to the board, and our employees this year will be held harmless in terms of the dollar amounts that will come out of their check. This next fiscal year, they'll pay their premium portion in accordance with their collective bargaining agreements. So that means that if an employee is paying 20% of their healthcare premium and 20% of the cost means that their deduction goes up by $2 a week or whatever, they will see and realize that increase in payroll deduction. But for this 9-month remaining in the fiscal year under this plan, no employee will pay more actual dollars for their healthcare than they're presently paying in terms of the premium cost share. So that, I would be content that the total 21-month cost appears to be 25 million, almost 26. We are annualizing those costs at 12,549,695 in both years, although because it's a 21-month broken up with 9 and 12, the numbers will balance in the end, but there may be a savings in this first year, as we discussed, that will be balanced, carried forward in a non-lapsing account in accordance with the law that we are now entitled to hold to cover any anticipated increase in the cost. So this will give us a 21-month plan. I really appreciate the administration soliciting those, because that does give us a long horizon where we can actually anticipate our year-over-year expenses, which is difficult in government, and give us a little bit of that stability. I think I've kind of gone through as much of the numbers as it merits, although if anybody has questions about them, I know most of you have them in front of you, or wants to read anything else out, certainly feel free. We've all heard about the benefits as well, so I don't want to regale you with the changes to vision, dental, and I think that's all I've got, although I know the School Administrators Association reached out with a couple of questions.
Yes, one I answered, and then the other one is specific to prescriptions, and that will be forthcoming when they start meeting. Kim will connect with Sheila when they start meeting with the staff. It's very similar to when you're switching doctors, if they have to switch doctors. There are some prescriptions that are a one-off that aren't generically covered. If it comes up, Anthem has historically been, most carriers are very flexible about accepting that medication. So without having to come up with a list of everything in the pharmaceutical world, they'll handle them accordingly. But they should have something, some sort of a somewhat inclusive list with the type of stuff.
Okay, so we'll get
The other one was specific to what the cost was, and I said there's no change in cost
right.
to what everyone's contributing.
Excellent. The only other question I received, and this was some time ago, I should have mentioned it the last meeting, was from one of our teachers who had just asked me about any gap in coverage because some teachers don't take paychecks in the summertime, so they were nervous about where their premiums were going to come from, and so the administrators and the brokers have made it clear that everybody's going to be held harmless in terms of where the money comes from and when. So that was the only question I received from any of our employees. I'm glad we were able to get them an answer. That's all I got. I'll turn it over to the group for discussion.
The only other thing, I'm glad there's no lapse in coverage, but we're also been told that this process was vetted through attorneys and everything is as it should be.
Yes.
Yeah, there's been some question about where the bids and the money comes in, so we're not paying Brown & Brown a dime, their costs are paid by the insurer, so we're covered there, we're not spending any taxpayer dollars on any no-bid contracts. I have the bids from the actual insurers in front of me, and the mayor was more than welcome as a member emeritus of this board to attend any of our meetings or presentations to see the bids herself. Anyone else have any discussion? All right, so with that then, I'm sorry, Jeff.
On the prescription side, I assume our employees would be covered as well by the guarantee from Anthem that they're going to get like coverage and they'll work in that transition period. Somebody who's concerned about that, I assume we've gotten that very generous agreement from Anthem that says we will make sure you're whole for a period of time and work with you to transition. So that was an important document to get.
Yeah, and I would just urge anybody, any member of the board or whomever who hears from an employee to steer them in the direction of, I assume, either Kim or to the broker or whoever to get that work done. We all heard Brown & Brown tell us that they are committed to making sure that they can advocate on our employees' behalf during the transition as well. There are likely to be, as we heard, a small percentage of doctors who may need to be transitioned out of. We hope that happens as rarely as possible. I think the number they threw out was somewhere in the 98% range of in-network. But certainly, let's make sure we all know we can steer them to people who can help them get their prescriptions covered, get their doctor visits paid for, to affect negatively as few people as possible. And really, I think this will be positive. I've heard dreadful things about our dental coverage, for example. So I know that there's going to be some real positives here in addition to the realized savings.
Just one last piece. I have a customer who uses Brown & Brown and converted from somebody who was smaller as they grew and they had nothing but positive things to say, that they had gotten a response similar to that of somebody who was much smaller, which as you get bigger is sometimes harder to do. So I'm sure our employees will be pleased with Brown & Brown's performance. I did just happen to run into it one day.
I just want the record to show that John joined the meeting at 5:48.
I did see
He was
it.
there, I saw it there.
Thank you, John.
Thanks, John.
All right, Marissa's got it. Hearing no further discussion, we have possible action, so I will, and you guys tell me if you think this is worded sufficiently, but I will hear a motion to accept the Anthem 21-month fully insured plan as our new as their bid for our new health insurance plan, with a total 2-year budget, $25,099,390, in accordance with the previously adopted Board of Education budget for this fiscal year.
So moved.
Second.
Okay, so moved by Mr. Galito,
Gary
seconded
and
by
Glenn?
Mr. Berger.
Yes.
Any discussion or debate on the question before us? Hearing none, I presume we can do this by voice vote, so all those in favor, please say aye.
Aye.
Any opposed or abstentions? Okay, then the motion carries unanimously, all 9 voting members of the board present. Thank you all for coming out. I know the delay wasn't everyone's favorite thing, but
Sorry about
I
that.
think it was worth doing. And thank you for our administrative team who really moved very quickly. This is a massive and cumbersome process.
Thank
It's
you,
over for
guys.
us, it's not over
It's
for
not
them.
over for, it's just starting for them.
So thank you all, and I
Thank
know
you.
our
Glad we're good.
employees
Yeah, good.
are being done good credit by all of your work. And with that, I will hear a motion to adjourn.
So moved.
Okay, made by Mr. Berger, seconded by Mr. Galito. All those in favor, please say aye.
Aye.